Good afternoon, nursing colleagues. I'm happy to be here today by video and sorry I couldn't join you in person to celebrate this wonderful achievement that you have all together come to this day to celebrate, the completion of your nursing program. In achieving the baccalaureate degree in nursing and in completing your NCLEX successfully, you're going to be entering one of the most exciting times in nursing history and in healthcare history that this nation has ever seen. I know today that you're, and I hope you are, gathered and surrounded by your friends and family who are here today to celebrate you. They know what a challenging journey this has been, as most of them have been by your side and have covered for you in times when your studies took you away to do clinicals, to attend sim lab, or the myriad of other things that are a part of this program and a part of you becoming the professional that I know you all will be. I want to just send also my congratulations from all of the people at WGU who are behind the scenes and who have helped to make your journey successful. This includes everyone from your enrollment counselor, who I'm sure you all remember with great fondness, to the financial aid people, to the student services people, to the IT people, the people that build the curriculum, the people that select the learning resources, the people that arrange for testing, the people who schedule your clinicals and your labs, the people who taught you in clinical and in lab. There are so many people who have been a part of your successful journey, and I just want to acknowledge them here today and tell you that they all are a part of your success and very, very happy that you have all come to this day and to this time in your career. So I said that you're entering a very exciting and challenging time, and I really meant it. In the most positive way. There are so many wonderful opportunities, new technologies, exciting transformations in the healthcare industry that you will all be a part of. And not only will you be a part of them, but you are equipped to help shape some of those changes in ways that will really be respectful of patients and their families' values and needs. And if there is one aspect of your professional formation that I am most proud of, it is the fact that we use a very student-centered approach in our education program, and we believe that that approach helps you learn how to be patient-centered. Patient-centeredness is probably the most important part of your approach to patient care and approach to your new career. I always say that the most valuable member of the healthcare team and the least acknowledged member is the patient. So I know that you'll make a big difference in that area. There are a number of challenges. For example, I was just reading that the incidence of preterm birth has risen dramatically in the U.S. in the last 7 or 8 years. We got a grade of a C nationally, internationally, for our preterm birth rate. It's really so disturbing to know all that we know and to have all the resources we have and to see that this critical measure of success is losing ground. In fact, the National Academies of Health say that preterm birth costs this nation more than $26 billion. Not only that, but we also know that preterm birth occurs disproportionately in individuals of different ethnicity and different populations and different geographic groups. So the issue of social disparities in health is something that I know all of you will be challenged to engage with, and I hope that you will help make a big difference in changing those numbers and reversing this downward trend. It's so important as we think about the future of healthcare and your future to think about the other ways that healthcare is transforming. I know that many of you will be working in hospitals, and at least initially, and I understand the drive and the interest there is really to become more skilled and more proficient, and many of you are going to even enter your hospital experience with a higher level of proficiency than many nursing students do because of the nature of this program and the kinds of experiences you've been able to have. in your clinical education. So while I understand that, I want to ask you to think about getting out of the hospital. As we look forward to the health of our nation, we're increasingly looking at community-based care models. We're increasingly looking at population health. And there are really good reasons for that. And nursing has a long and storied tradition in guiding community-based care and population care. The kind of impact that we can make in patients' lives and their families' lives before they become sick is really the most significant contribution that we can make to the health of this nation. So even if you're working in a hospital, even if that's where you're focusing your initial part of your career, I ask that you not think about yourself and your patients as being in that hospital silo, but think about how they got there, and think about how they're going to get home, and think about how they're going to cope with what they need to cope with when they do get home, because that truly is the essence of nursing care. I want to also just say that as I congratulate you and welcome you into the nursing profession, how incredibly proud we are of all of you. You've really shown in this program, and I'm happy to announce, if you haven't heard already, that the Texas Board of Nursing has recognized that the WGU Pre-Licensure Baccalaureate program has improved some of the challenges that we had previously. We've been returned to full approval by the Board of Nursing. And in great part, that's due to the success of our students. When our students succeed, our program succeeds. And a big part of that approval process was looking at student success outcome data on the first-time NCLEX pass rate. So congratulations to all of you who've already taken the NCLEX, who were part of helping to move the program forward in a more positive way. We want to make this program available to more students like you who may not have had a chance to fulfill their dreams in nursing. We know that our average student is not like most average nursing school students, and we value the fact that we're able to offer an opportunity for those who are motivated and who are willing to work hard to fulfill their nursing dream. And we ask that you continue to be an ambassador to others that you run across who need the same kinds of opportunities that you've had. Finally, we feel like we're a part of your success, maybe a small part, but many of us have contributed in ways visible to you and invisible to you in your achievement here today. So we're very, very interested in knowing how your career progresses. We would love to hear about new jobs. We would love to hear about additional academic experiences that you choose. We'll be in touch with you in various ways with surveys and phone calls, sometime within the first 6 months of practice and thereafter on some regular basis. And I hope you'll continue to engage with us, because we really value understanding what it is about the experiences that our students are able to go on to, and how those experiences in life, in their career, in their professional advancement may give us guidance in making our program even better. So I hope that you'll continue to take our calls, fill out our surveys, and stay in touch. Your success is our success. Lastly, I just want to leave you with a couple of words of advice, because a commencement message would be nothing without advice. And really, there's just two quick phrases that I want to share with you. First of all, be present. I think it's very hard in this age of distraction to find times to be personally engaged with our patients or with their families. There's so many distractions. There's so many things on your list of things to do. But if you truly want to find the joy in your practice, you will find it by carving time out to be present with your patients, to be present with your families. To not every minute of every hour of every day is that possible, but to make it a priority to find time when you can truly be a good listener, a person who is most interested and totally engaged in what is going on with them and what they have to tell you. And even if they tell you nothing and you just sit by the bed and hold their hand, those moments of engagement make all the difference, both in the health of that patient, in their ability to manage whatever it is they're managing in their lives, but also in the joy you'll find in your own practice. My last word of advice is be curious. There's no question there are a lot of things coming up on your horizon, things we can't even have begun to anticipate. But mostly, I think while you're trying to keep up with technology and you're reading your journals and you're learning new things, I hope you'll be curious about the people in your profession, your peers, your supervisors, other people in other disciplines. Get to know them, get to understand them. Be curious enough to spend the time to invest in learning something about someone else, what someone else is doing, because that path is also a path for you for personal satisfaction and personal success. So my last words are congratulations. I hope you have a wonderful pinning. I know that many people in this room will be there to support you today, and I'm so happy to call you now my nursing colleagues. Congratulations.